Madam Speaker, I want to thank the gentleman from Florida as we begin a new year and a new Congress with an opportunity to work not only with the gentleman but also my colleagues from the Rules Committee and you, Madam Speaker, during this new Congress. And I thank the gentleman for yielding me the time that he has done. Madam Speaker, I rise today in strong opposition to this rule and to the ill-conceived underlying legislation. I think the premise that I have heard my friends on the other side of the aisle talk about today of making sure that we just expand this program to meet every single need of every single child is not what this program was designed for, and a $35 billion expansion of the program will help bankrupt this country and the states that try and provide the services also. I do not support this bill or the way it's been brought to the floor either. My Democrat colleagues on the other side of the aisle who promised to be the most open and honest, ethical Congress have once again given Republicans absolutely no say in the process. And they are completely disregarding President-elect Obama's promises to work together to solve the problems of this country. Today, House Democrats have once again chosen to force their own legislation through a biased rule that we are here debating on the floor of the House right now. This bill has been brought to the floor today without one committee hearing or markup. The current SCHIP program expires on March the 31st. And so I would ask my colleagues, why aren't we having hearings? Why aren't we having input from House members? Why aren't we consulting Republicans in this process? In fact, Republicans only received the text yesterday morning. And today's rule once again limits the Republican opportunities for any chance of reform or ideas, confirming the Democrats' plans to govern this House without any input from Republicans. Democrats over the past few years have demonized me and my Republican colleagues for not expanding the current state children's health insurance program to unprecedented levels. And they continue to cry out the Republicans are anti-children. I would like to remind them that it was a Republican Congress that initiated this program over a decade ago. It was begun to make sure that children that had no health coverage could gain that coverage. However, my colleagues and I recognize the need for SCHIP, and we see that we need to help low-income, uninsured children whose families earn too much to qualify for Medicaid, but not enough to buy private coverage. For that reason, SCHIP was created and today covers about 6.7 million children in our country. However, today we find that the Democrats proposed $35 billion expansion of a program that has not yet accomplished its original intent is now being taken to unprecedented levels by my friends on the other side of the aisle. My Democrat friends want to continue to push their government-run health care agenda, even though this legislation moves some 2.4 million children who are currently on private health insurance public program with less access. I'll repeat that. The numbers that my friends have been talking about of expanding this to children across this country, 2.4 million of them already have private insurance. That's a mistake. It's a mistake, and so now what we're looking at is that Medicaid programs facing extreme shortfalls and physicians who are scaling back on Medicaid and SCHIP patients due to extremely low reimbursement rates will now take on these additional children. Why would we want to subject 4 to 6 million more children this kind of care? Madam Speaker, it seems like my Democrat colleagues are putting their agenda first, not our American children. This legislation turns an innovative idea on its head by increasing government spending exponentially, leaving taxpayers to foot the bill when their budget gimmicks fail to create the unnecessary ability to fund properly these programs. This bill has no income limits for eligibility, none, and it allows coverage for families making up to $83,000 a year and has no annual authorization limit and allows states to decide who qualifies, leaving adults and illegal immigrants to compete against low-income American children. Madam Speaker, it should be important that we should meet the current goals of the program and expectations before we expand that program. But for that reason, some of my Republican colleagues and I sent a letter to our new President-elect, President Obama, and Speaker Pelosi, outlining what we think Republicans would like our Democrat colleagues to understand and consider before expanding the current SCHIP program. I'd like to ask unanimous consent that I include this as part of our deliberations.
Is there
today.
objection? Without objection, so ordered.
The first priority should be to make our nation's poorest uninsured children covered. This is the intent of the program, and we should fulfill that program and that goal. Currently, at least two-thirds of children who do not have health insurance are already eligible for federal help through either SCHIP or Medicaid. We should enroll these children first before expanding to higher income brackets. The second priority is to ensure that SCHIP does not replace or significantly impact those who already have private health insurance with a government-run program. Last year, Hawaii created a new government finance program to fill the gap between private and public insurance in an effort to provide universal coverage for children. But state officials soon found that families were dropping private coverage to enroll their children in the government plan. The governor of Hawaii terminated the plan when she realized Hawaii could not and should not subsidize the cost for children already receiving private health insurance. Madam Speaker, should this legislation pass, we know that 2.4 million more children will be crowded out from their private insurance plan and moved to SCHIP. In days where Congress is faced with a second $350 billion bailout plan and a possible $1.3 trillion stimulus package, is the federal government in any financial shape to be financing health care costs for children who are already receiving private health insurance?